Jefferson Center for Mental Health is the community mental health center serving Jefferson, Gilpin, and Clear Creek counties. We've been part of this community for over half a century. We have programs for children as young as 2, senior programs, and I know we have at least one client who's in her 90s. And we provide services for the whole continuum in between.
Some people say that Jefferson Center is the best kept secret in our community. And unfortunately, I think sometimes that's true because a lot of people don't know about us and the services that we provide.
We have a criminal justice mental health program for people that are involved with the legal system. We have El Centro Dones, which is a specialized program for Spanish-speaking citizens in our community. We have a wellness program that is open to anybody in the community. Navigation services that assist people in finding whatever kind of help they might need. We even are participating in a nationally recognized program called Mental Health First Aid.
That trains people in the community what they need to know to understand what to do when someone has a mental health problem, but probably even more important to recognize the signs and the ways that they can help folks who are needing support.
We have a walk-in crisis center at our Union Square facility. People need to be able to get help when they need it. Anyone in the community is welcome to walk in at any time and get the help and support that they need to get through the crisis. We also have a mobile crisis team that will dispatch out into the community.
It's really important that we understand what the community's needs are.
One of the specialized services we've developed are services for veterans and their families.
A staff member and her daughter lost a member of their family in Iraq. And they looked around and looked hard and they realized there was nothing for military families in this area. That there was no organizations that provided these mental health services for military families. And then through support of the whole center, really, this idea for a program that serves the needs of veterans and their families came to be.
I was spinning my wheels. I did not know what actions to take. I thought I had exhausted all opportunity for help for my husband.
Veterans and military families don't like asking for help.
He's strong, he's tough, he's ex-military. He doesn't need help.
I think we all know about the challenges that our service members face overseas, be it the long hours, the dangerous firefights, the craziness of war.
He doesn't need to ask for help.
But honestly, we have battle buddies to the right and the left of us that are going through the same thing, that we're part of a team and we know we can't fail. We have those resources that are there for us.
He was increasingly becoming reclusive. He was withdrawing from society. He was withdrawing from his family, his wife, his parents, his children.
War's war. The needs are the same.
Was not getting better over time, it was getting worse.
I think one thing that is often missed when we're talking about this military population is the military family.
Stopped and started treatment, couldn't find a provider who was perfect for him, who he could relate to and who he would listen to, open up to, and trust.
I'm an Iraq veteran. I served in the Army as a mental health worker, and then I'm now a social worker. So I've had experience counseling veterans for 7 years.
He said he was willing to try. And that one word, if he's willing to try, that's just wonderful.
We're here to help people with their issue, give them skills to resolve these issues and manage them on their own. Because honestly, we're gonna have nightmares, we're gonna have sleep problems, we might get irritated in crowds, but we can control these things, and giving veterans these skills and the families these skills can really help them, give them the quality of life that they deserve.
It's really lessened my stress because I'm not the one who's putting out 100%. Now he's putting out 50%, I'm putting out 50%.
Issues that veterans experience include PTSD, depression, anger problems, drinking and other substance abuse, marital problems, family challenges, and unfortunately suicide.
I didn't know that he had made some attempts. I did not know that. Now I do, and he himself has said he no longer feels in danger.
By recognizing that this need and providing the treatment that this military family needs, they can reunite, reconnect, rebuild, and the phrase we like to say in the military is Charlie Mike, which means continue mission. They can get on with their life.
My husband is night and day from where he was before. Even his parents can tell a difference on the internet when they chat with him. He is now engaging in his family again. He is participating in his kids' activities again. He went to his son's concert at high school. He is reaching out. He is making an effort to do little things around the house when before his exact words to me were he felt like a piece of furniture. And now he's doing things, he's being more active, he's finding that he can see down the road that there is hope, that there is something better, that there is purpose and happiness to be had.
Our community sends people off to war. We're responsible for when they get back.
My husband knows that Jefferson Center has helped him.
Sometimes families spend days, weeks, years looking for help for their loved ones and not knowing that it's available. And if we can save families those periods of anguish and concern by letting folks know that we're here, that's really important.
We live in this community. This is our community. We're part of the community, and our goal is to do everything we can to ensure that services are accessible to anyone who needs them and that mental health matters.
Jefferson Center was a lifesaver, literally. Support our organizations who support our veterans. There's not enough resources to go around, so we need the community to help as much as possible.